Okay, the next point you make is, and you've referred to this a little bit earlier, so that should be fine. You say, have some time dropping out. Now, you've mentioned it before. I think I've got a handle on what you're talking about, but can you just expand on that, Kev? What this dropping out? Is it
okay if I elaborate?
You can elaborate or expand or both.
Yeah, okay. Yeah, there will be a period, usually at the beginning at some stage, where people will be thinking and probably saying, snap out of it, pull yourself together, shake yourself, there's people worse off than you, and that's the delicate time that I personally think that an individual needs to absorb how they're feeling, get the brain around it, accept, as I said before, that something's not right and it's an illness, and you have to treat the illness with respect, and you have to have time. Now, quite often it means your hygiene suffers, you don't eat properly, you don't keep proper sleeping times, and you don't change your clothes. I personally think that's natural to the way you're feeling in the beginning, and I think that should last 2 weeks, maybe 3, but try and keep it to 2 weeks, and maybe sort of let the feeling overcome you and take your position of that's where you are, and the people watching, like family or friends, I think should try, if they can, and respect for a week or two that you're not yourself and that's how you're feeling. And if any doctors get involved, whether you get taken to the doctors or whether they come to see you, it will cut down on an awful lot of questioning. When they see the way you look and your body language, that will save a lot of time, that they'll be able to say you're actually suffering with depression. There might not be any clear signals why, but then that becomes the starting point for you getting better eventually.
So this dropping out period, whether it be 2 weeks, 3 weeks, as you say, it'll be different periods of time for each individual because we're all different. But what are the benefits of the dropping out time? What do you get out of it?
Well, a friend of yours wrote about it once in the song on Revolver, I'm Only Sleeping. I'm pretty sure it was an afternoon when him and his auntie didn't see eye to eye, and he just wanted to be left alone, and she probably thought he should be out doing things. That's the same with depression. The person wants to be left alone for a bit, to lick the wounds and take stock of what's happening around them. I think if you disturb them, then they can do something out of character, like hit out a bit too much, like a dog that's been injured and battered. Quite often they're nice dogs, but they don't seem it if you go near them too quick when they've been hurt, because they go to bite you, they go for you. They need that bit where they just handle with kid gloves and be left alone a little bit. That's the same for anybody with depression. The benefits of leaving them is they can absorb how they're feeling, where they're up to, and also the family around them can see that they're not themselves and they need to be left for a week or two to absorb it all. The benefits are that it will save time with the doctors, because they'll be able to see and sense that you're not right. The people around you will know that it's an illness, you're not swinging the lead like some people trying to make out, which is one of the key factors, one of the key problems with depression. A lot of the symptoms are the same as somebody who's lazy. You can see why where the confusion is. But if you can acknowledge and give them that space and time, the advantages are that the person will be better to work with once they've had the time. One of the big advantages are that after a week or two, the individual will get bored by just doing nothing and hanging around. Part of them will want to come out of it, so that's an encouraging part.